The nervous system is a complex network of cells, tissues, and organs that work together to transmit signals throughout the body. It plays a critical role in the regulation of all bodily functions, including movement, sensation, and even thought. One of the most important aspects of the nervous system is its ability to communicate with other parts of the body. The nerves that make up the nervous system serve as the pathways through which signals are transmitted. The primary centers of communication are the brain and spinal cord, though impulses can also come from internal organs, muscles, and sensory organs. In this video, our focus of discussion is a structure called the lumbosacral plexus. In fact, it is not a singular structure but can be divided into two separate plexuses called the lumbar plexus and sacral plexus. The numerous nerves that supply the lower limb, making it possible for us to move about and perceive sensations, originate from these two plexuses. We will explore the anatomy of these two plexuses, the nerves that originate from them, their functions, and the various conditions that can affect them. Here at sqadia.com we have covered many topics related to regional anatomy, including the lower limb anatomical region, such as gluteal region, region of thigh, leg, foot, and much more. You will benefit much from understanding the regional anatomy because it will be much simpler for you to comprehend the explanation of the nerve's course in this video. Asking and answering questions can aid in memorization and understanding of the lower limb nerves. I will continue this video lecture by addressing the following questions. The first question is the obvious one, since we want to learn about names and function of the nerves that supply the lower limb. So, we can word the question as: what are the different types of nerves that control the lower limbs, and what are their functions? The second question that we'll be able to answer at the end of this video is, what are some common conditions that can affect these nerves? To answer the first question, let me enlist the nerves that innervate the lower limb. Here are the names of the nerves of lower limb. Obturator nerve, which supplies the medial aspect of the thigh. Femoral nerve, supplies the anterior aspect of thigh. Posterior femoral cutaneous nerve. This nerve is responsible for the sensory innervation of posterior aspect of the thigh. Lateral femoral cutaneous nerve. Genitofemoral nerve. Iliohypogastric nerve. Ilioinguinal nerve. Sciatic nerve. Thickest nerve of the human body. Tibial nerve, terminal branch of sciatic nerve. Common peroneal nerve, and its two branches. Superficial peroneal nerve. Deep peroneal nerve. Then we have the pudendal nerve. Superior gluteal nerve. Inferior gluteal nerve. Well, that's a lot of nerve, right? I know what you must be thinking now. How am I ever going to memorize all these names and remember them for a long time? Do not worry, dear student, for I am here to help you. As I mentioned earlier, these nerves originate from two plexuses, so there is an easier way to memorize them. If you look here, you can see that the nerves can be grouped as such. The sciatic nerve, a major, in fact the largest nerve of the lower limb, gives of these branches that innervate different areas of lower limb. Remember, nerves to the lower limb are all these nerves that branches of two important plexuses, called the lumbar plexus and sacral plexus. The nerves that originate from the lumbar plexus are 6 in number. These are obturator nerve, femoral nerve, lateral femoral cutaneous nerve, genitofemoral nerve, iliohypogastric nerve, ilioinguinal nerve. The nerves that originate from the sacral plexus are 8 in number. These are sciatic nerve, tibial nerve, Common peroneal nerve. Superficial peroneal nerve. Deep peroneal nerve. Pudendal nerve. Posterior cutaneous nerve of the thigh. Superior gluteal nerve. Inferior gluteal nerve.
Isn't it much easier now to memorize the names of these nerves?
Just keep memorizing this visual chart and you can easily retain the names of these nerves. You do not need to put in the time and make up your own notes.
For at sqadia.com, we provide you with a PDF file version of this very lecture. See, isn't it awesome?
Just download the PDF from the link in the description below. Coming back to our video, continuing forward, I will break down the video lecture into parts. First, we will discuss the lumbar plexus, its anatomy, location, and nerves that branch off from this plexus. Then I will teach you about its major peripheral branches that supply the region of the thigh. These nerves are called the obturator nerve and the femoral nerve. These nerves supply the medial and anterior compartments of the thigh respectively. To learn about the sacral plexus and the nerves that originate from it, watch our video titled Sacral Plexus. By the end of this lecture, you should have a deeper understanding of the important role that the nervous system plays in controlling movement and sensation in the lower limbs, and the various ways in which nerve-related conditions can impact this critical system. Now let's move ahead and look at the nerves that innervate the structure of the lower limb. Wait. I need to tell you something first. When it comes to nerves, it's not just about their names and functions, but also their roots. The root value of a nerve tells us where it originates in the spinal cord and what type of fibers it contains. This is important because it can help us pinpoint the location of an injury or determine what types of functions may be affected. Knowing a nerve's root value can also be useful in diagnosing conditions like herniated discs. By identifying the affected spinal cord segment, we can plan appropriate treatments. When we talk about the two plexuses later on, you will see these structures labeled as such. Just keep in mind that these are the root values of the spinal nerve. If a nerve is formed by a combination of two spinal nerves, both of their root values are mentioned together. For example, the root value of genitofemoral nerve is L1, L2. You can see that fibers from both L1 and L2 merge together to form this nerve. So, whether you're studying to be a doctor, nurse, or other healthcare professional, understanding the root values of nerves is crucial. It's like having a map of the nervous system that helps guide us in providing the best care for our patients. Let's jump in and learn about the lumbar plexus.
Ditch the hefty textbooks and embrace the convenience of learning on the go. Our interactive video content keeps you engaged, making learning medicine enjoyable